Hi, my name's Seth Johnson. I'm the Mesa Fire and Medical Department Wellness Captain, and I'm here today at East Valley Wellness to let you know what to expect when you come for your yearly medical and fitness examination. When you first get here, we're going to check you in, and then we're going to gather some information to make sure that you're cleared for today's assessment. All right, so now we're going to gather the hip and waist circumference, and then we're going to take the ratio to determine your risk for comorbidities down the road. We're going to start by measuring the waist in centimeters, and then we're going to move down to the hips, and then we're going to take those two measurements and compare them to each other. The hips should be the widest part of your average healthy body. And then we're going to take that information, give it to the doctor so that he can help you in your assessment. So here we have the hip mobility portion of the assessment. This device here is going to automatically measure the angle at which Scott is able to raise his leg. So we'll start with the leg that we're not testing on the ground, and the leg we are testing will come straight up into the air, slowly and controlled, and at the top point, he needs to be able to hold it for 2 seconds. Good.
All right, here we are at another new event, and this is shoulder mobility. And we're going to take this dowel that has all these predetermined measure marks. We're going to take the furthest tip of it, and we're going to put it in the candidate's wrist, and we're going to measure to the very distal portion of the furthest finger. We're at a mark of 20. We take that number, and we multiply it by 1.5 to get us at 30. We're going to instruct the candidate to make a fist with the thumb inside the fist, and they're going to bring their hands together on both sides. Just as we see, we're going to measure from the furthest tip all the way down until the closest, and we're right about the 14 or 15 mark. And so that gives us well within the range that we're allowed. We'll also ask the candidate to switch arms because we also want to identify asymmetries. And so as you can see here, we're a little bit closer to that 30 mark. So this is an asymmetry that we would identify. This is a great mechanism to identify asymmetries and for us to instruct that candidate to continue to do mobility exercises to prevent injury.
So now we have another new event, the vertical jump. This is going to test the member's power. Here we have Scott set up on our Evolve Force Decks, and this is going to measure his power and the height of his jump. So to perform this, it's going to be a concentric jump with hands that are going to stay on the hip, and we're going to go down to where you're comfortable from jumping and extend all the way up to a full jump and then land smoothly. You're going to get 3 repetitions, and we're going to score your highest jump. So now we're going to administer the aerobic capacity portion of our test. This is going to be done using a stair climbing machine. We're going to use a heart rate monitor strapped around the lower portion of our chest. If you have any trouble with this reading your heart rate and you know it, please let us know. We're going to ensure that the backside of this is wet and adheres to your skin tightly so as to get an accurate reading. We have Scott here on the stair climber. We have him set in the warm-up. The warm-up lasts 3 minutes. During the warm-up, you are allowed to hold on to the rails to help gain your balance if needed. After the 3-minute warm-up, you are no longer allowed to hold on to the handrails. We are going to remove Scott from the test once he's reached his predetermined heart rate for more than 15 seconds. And that is pre-calculated prior to getting on the stair climber. Following that, you will have a cool down period.
For some of the members, we're going to have them do a stress ECG or a stress echo. So you won't be completing the Stairmaster at an 85% submax test. This test is going to be done at a maximal test or maximal capacity, trying to achieve a 12 MET value for each of the candidates. We're going to hook you up without your shirt on to an ECG and either do that stress ECG or stress echo. The members that will go through this are predetermined on a schedule or are at higher risk for cardiac dysrhythmia.
Here we have the push-up assessment. Scott here is set up on the perfect push-up, which is an option for those that have wrist mobility issues or injuries. We're going to do it to the beat of a metronome. We max out at 2 minutes and 80 reps. Now we're moving on to the horizontal pull-up. This is a new event that you haven't seen before. So let's take a look. Here we have Scott set up. We're gonna make sure our feet are flat on the ground. We're gonna make sure at full extension that there's at least 1 inch of clearance between the ground and Scott's back. And then the all the way up position is within 5 inches. And we're gonna go at a beat of 80 beats a minute. This year we have another new event, the side plank. If you see Scott here, he's set up in one way that you can position yourself. Another is by putting your top foot directly in front. A lot of people may prefer this method. We're going to test each side individually for 4 minutes. After 4 minutes, that side is done. We'll take a break and now test the other. So you see Scott's hand straight to the side. That's where we want to keep it. As part of your medical and fitness examination, we're also going to do mass fit testing. Here on the table, we have what you will be tested on. We have our filtering devices, which will ensure that you leave being tested successfully on one of them. If you do not currently have a P100, we can issue you one here at MediValves. Also, we will have our usual SCBA mask where this will be inspected, and then you will be mass fit test on it to ensure you still have a quality seal that will protect you. So Scott, we've done blood tests, we've done urine analysis, we've done the fitness evaluation, and now the MediValves. So what's the doctor going to do with all this information?
Yeah, so once we send that to the doctor has a checkout process. And so with that checkout process, they're just going to put it together with all the information so that they have a comprehensive overview of what you look like and your overall health. So they're going to sit here, they're going to review all your blood, they're going to review your labs, they're going to review the information that we send to them, and then over here, they're going to do a full physical assessment, right? Head, shoulders, knees, and toes. They're going to check your ears, they're going to check your mouth, they're going to check your eyes, check your stability, mobility, and if we identify any discrepancies in any one of the exams that we send them over, then they'll be able to do a thorough assessment on that as well.
Hello, brothers and sisters of the Mesa Fire Medical Department. This is Dr. Gary Smith. I so look forward to reuniting with so many of you during your upcoming wellness exams. You know, it's interesting to note the National Fire Protection Association, the NFPA, has organized a health standard for each and every one of us as we strive to serve our communities to the best of our abilities. And we have opportunity this upcoming year to help you with those physical examinations. Again, I look forward to being with each of you and hope that you will be safe and find happiness as you continue to serve our community, the public, those that are visitors of our cities, and for all others that you take opportunity to serve. Thank you, and have a lovely day.
Well, that's it. Thank you for attending this year's medical and fitness assessments. I hope you gained information that can help keep you safe and healthy for the years to come.